Hello, my name is Amaya Martin. Today I'll be discussing my campaign to face health disparities in Southwest Georgia. I want to begin by saying that these issues are not only in the South. They are in rural areas across the entire country and the globe. Although they differ on how they begin and grow in these areas, the issue is still there. There is a systematic disadvantage in healthcare of people who live in these regions. In order to best understand this topic, the theory of uncertainty reduction and anxiety and uncertainty management theory are important and should be applied. Uncertainty reduction theory is usually when people are having conversations and there is an uncertainty within the communication. This is how people will respond and react within those situations. The other theory, also known as UAN, is how the delivery in those situations or similar situations are handled upon the expectations of those anxieties that are present. Within this situation, I have two audiences. It is the people of these areas that face the issues themselves, and it is the healthcare providers. For that theory, uncertainty reduction theory falls better on the patients and the citizens of those areas, and the other is better for the providers. This is because providers are the ones in charge of handling conversations with their patients, considering the best way to deliver this information about their life and their health and how they're going to understand it based off of their culture and the way that they understand things and their education levels. Uncertainty reduction theory is best for patients, citizens, because they are often the receiver of those types of conversations and having to share that information with the people in their lives they care about, who are there to help them get through it and provide for them. I chose this theory because I'm from one of these communities and I see this type of thing happen. At my previous job, there were numerous people who had complaints of their health alone and not just of daily lives. We have people who have to travel miles at a time just to get prescriptions. And in cases like this is why the financial status in these small communities that are also facing financial concern as well as those health concerns really begin to struggle at a rate that is higher than those living in urban areas. People living in these communities often have to deal with driving long distances, even within their own communities, when there is only a handful of locations that they could go. And because it is smaller communities, there are smaller practices, which means there are going to be longer wait times, more difficulty with finding consistent availability with your prescriber, and for people who begin to need that care as well. Those that are most disadvantaged are going to be the elderly and young people and young families, whether it is single parents or young married parents. Often, people in these communities are on fixed income, which means that they also have to worry about the cost of that care and the cost of their daily life choices. Sometimes it becomes between having your insurance or having a meal. In these situations, there's a strain put on the person, especially when they have to travel far distances to reach that care. Healthcare providers are feeling this impact as well, as far as wanting to be there for their patients while also having enough energy for themselves to be able to properly do this, which is why we should introduce affordable local transport as well as incentives to bring healthcare workers from other areas into these communities with the goal of having them transfer long term so that patients have larger access within their own communities instead of having to travel so far. By doing this, it'll just simply increase the chance that people can beat preventative diseases by having primary care at an accessible way within their own community. Because these counties are often surrounding each other and they're small, people can crowd into one place. With the goal, I would hope that this campaign would bring more people, and then in that case, potentially they will decide to open their own practices that are going to be better for these communities so they have more variety that are close to home. Thank you for listening.